Hello, students. In this session, we will look at the stomach. Here we are looking at the anterior view of the stomach along with its surrounding structures. The stomach lies in the upper left part of the abdomen, mainly occupying the left hypochondriac, epigastric, and umbilical regions. In the upper part of the image, we can see the thoracic part of the esophagus and the aorta just above the diaphragm. The cut ends of the liver and diaphragm are shown to provide a clearer view of the anterior surface of the stomach. Just above the liver, note the cut end of the inferior vena cava. Between the liver and the lesser curvature of the stomach, we can identify the peritoneal fold called the lesser omentum. On the left side, connecting the stomach and the spleen, is the gastrosplenic ligament. Running along the greater curvature, the gastroomental artery can be observed. Finally, beneath the stomach, we can see the transverse mesocolon, marking its relation to the large intestine. This image shows a coronal section of the stomach, revealing its internal features. The stomach is divided into three main parts: the fundus, body, and pyloric part. The cardiac notch lies between the lower end of the esophagus and the fundus. Just above the cardiac notch is the fundus of the stomach, forming the dome-shaped upper portion. On the right side, we can identify the lesser curvature, while on the left side, the greater curvature is visible. At the lower end of the lesser curvature, there is a small indentation known as the incisura angularis. The region between the cardiac notch and the incisura angularis represents the body of the stomach. Within this body, we can observe several longitudinal mucosal folds, known as rugae, which help in the expansion of the stomach. Below the incisura angularis, we find the pyloric antrum leading into the pyloric canal. Together, the pyloric antrum and pyloric canal make up the pyloric part of the stomach, which continues into the duodenum. This image presents the posterior surface of the stomach, viewed from below and behind. Along the greater curvature, we can see the right gastroomental vessels running along its lower border. In the upper part of the greater curvature, three key structures are visible: the short gastric arteries, the left gastroomental artery, and the gastrosplenic ligament, which connects the stomach to the spleen. The image also highlights the posterior surface of the stomach and the region known as the stomach bed. Lying deep to the peritoneum, the pancreas forms the main structure of this stomach bed. In the lower part of the image, the transverse mesocolon and the transverse colon can also be identified, showing the close relationship between the stomach and these surrounding structures. This image displays the structures related to the lesser curvature of the stomach. Posterior to the stomach lies the pancreas, forming an important relation on its back surface. After removing the left lobe of the liver, we can observe the bile duct, the proper hepatic artery, and the portal vein, all enclosed within the free border of the lesser omentum. Running along the lesser curvature, we can identify the right and left gastric vessels supplying this region. At the upper part of the lesser curvature, the esophageal vessels are also visible. Once the left lobe of the liver is removed, the caudate lobe becomes clearly seen. Finally, just above the diaphragm, the anterior vagal trunk can be seen descending toward the stomach, providing parasympathetic innervation. This image shows the major vessels visible after the removal of the stomach. At the center, we can observe the formation of the portal vein, created by the union of the superior mesenteric vein and the splenic vein. The celiac trunk and its three main branches are clearly seen: the common hepatic artery, the left gastric artery, and the splenic artery. Just below the origin of the celiac trunk, the superior mesenteric artery arises. At the hilum of the spleen, the splenic vessels are visible entering and leaving the organ. After giving rise to the gastroduodenal artery, the common hepatic artery continues as the proper hepatic artery. The uncinate process of the pancreas can be seen lying close to the third part of the duodenum. Posterolateral to the portal vein, the bile duct is positioned, while on the left side of the portal vein, the inferior vena cava can be identified. This image shows the nerve supply of the stomach. After removing the left part of the liver, the vagus nerves supplying the stomach can be clearly seen. The parasympathetic fibers to the stomach are derived directly from the vagus nerves. The anterior vagal trunk, formed mainly from the left vagus nerve and partly from the right vagus nerve, enters the abdomen on the anterior surface of the esophagus. From this anterior vagal trunk, a hepatic branch or branches arise and pass through the upper part of the lesser omentum towards the porta hepatis, where they contribute to the innervation of the liver.